Hi guys, this video is about corticosteroid injections for Achilles tendinopathy, and I'm going to talk about what the risk factors are, whether they're useful, should you consider them. My name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your Achilles injuries. So have a look at our link to the website is in the description of this video. Okay, so what's the research saying about tendinopathies and corticosteroid injections? Now, the vast majority of research on this topic has been done for tennis elbows, and what it shows is that it's extremely good at dulling pain. And the research on Achilles tendinopathy supports this as well, that if you've got a painful tendon, a corticosteroid injection can take the pain right down. But the problem is, if you look at long-term follow-up, and at the moment there's a lack of studies about this in Achilles tendons, so I've had to go back to the tennis elbows because it's the only place where they've got long-term research on this. If you look at those same patients at 6 months later, those ones that had the corticosteroid injections are actually worse off than the guys who just followed a rehab program and other treatments. Also, if you look at them 4 years after receiving the injections, again, the ones that had the injections are usually worse off than the guys who just followed a rehab program. So there's some evidence in there that actually in the long term, corticosteroid injections aren't great for tendons. And the reason for this is, or maybe that corticosteroids actually interferes with the healing process of tendons. So remember, all our tissue in our body is constantly turning over. So for tendons, that's collagen fibers, that's constantly, the old ones are being taken away, new ones are rebuilding them. And when you have a tendinopathy, remember, that tendon has not repaired properly. So you want new fibers, strong fibers to form to support the tendon. But now if you have a corticosteroid injection, it dulls the pain, but it interferes with how well your body can form new collagen fibers. And that's why these patients are actually worse off 6 months or 4 years later, because their tendons, although the pain went away quite quickly for a short period of time, didn't repair properly, and they're continuing to have issues later on. So there's also some research to show that there's a small rupture risk for your Achilles tendon if you have a corticosteroid injection. But like I said earlier on, there's a lack of really good research studies to look at the long-term effects of this in Achilles tendons. And I think part of the reason is because the early studies showed that there may be a risk of tearing, that people have stopped investigating it. So my advice would be there are other options. If you're in a lot of pain with your Achilles tendon, consider things like shockwave, consider things like PRP injections and other treatments first before you go for corticosteroid injections, because the risks with those other treatments are relatively low compared to corticosteroids. You can have a look, I've made videos about those type of injections and stuff as well. Excellent. If you've got any questions, feel free to ask them in the comments or message me direct. But if you need more help with your Achilles injury, you're welcome to consult one of us through the website via video call. Have a look. Link to the website is in the description of this video. Take care.